Let's take a look at Medicare Part D. Whenever we sit down with someone by Zoom, over phone, or in person, we always ask for a complete list of their medications and the name of their pharmacy, because the pharmacy that you use on Medicare makes a difference. We also want to make sure that all of your medicines are in the plan's formularies. And just like in the beginning, when I talked about that initial enrollment period, we definitely want to make sure that we meet that as well with your Part D plan. So that way you don't have any penalties that will follow you for the life, your Medicare journey life. And then the other thing is there's an annual open enrollment period that happens from October the 15th through December the 7th. Medicare opens up this window for you, the Medicare beneficiary, to reshop and review your plan. So I believe this is very, very important, because not getting on the right drug plan could cost you hundreds, even thousands of dollars every single year. I've already talked about the annual enrollment period that you see here. Why is it important? Why do I stress this? Because you need to do this every single year. You don't need to adopt a mindset of, well, the drug plan's been working for me, so if it's not broken, I'm not going to try to fix it. You do not want to do that when it comes to a Medicare drug plan, because these are one-year agreements, and the tiers of drugs can change. They could take your drug completely out of the formulary for the following year. So you definitely want to make sure that you review these every single year. Now, for 2025, some of the big changes due to the Inflation Reduction Act is, number one, is they have implemented a $2,000 max out of pocket. That's good news for you, the Medicare beneficiary, especially if you are taking multiple high-tier drugs. Now, to give you some context, last year, the maximum out of pocket was $8,000. So that's a huge burden off of you, the Medicare beneficiary's shoulders. Also, they removed the donut hole. This is something that has been plaguing Medicare beneficiaries for years. Also, the proper name was the coverage gap, but most people know it as the donut hole. So that's good news for you. So that way you don't have to pay 25% of the retail cost of the drugs. They've also implemented a Medicare prescription payment plan where you can spread out the cost of your higher tier drugs over a year span. And then the annual deductible was raised from $545 in 2024 to $590 in 2025. Here's some examples of some low and high tier drugs. Why do I show this today in the webinar? Is because if you're on lower tier drugs, they're not going to trigger that $590 deductible. But if you're on some of the higher tier drugs, in most cases, it is going to trigger that deductible. So this is why we want to look at this when you first go on Medicare. So that way you're aware of, hey, maybe I need to get off of one of these higher tier drugs, name brand drugs, and get on a generic drug. Testing. Okay. All right. Just like with Medicare Part B, I had an IRMA penalty, or I could incur a IRMA penalty, I should say. It's the same thing with your Part D. If I fall into one of these higher income categories, I could be assessed this penalty, and they're going to use your 2023 modified adjusted gross income to determine what that premium is. Now, here's the good news. Most people are going to be in that top category, but if you do feel like you can fall into one of those other categories, this is something that we definitely want to discuss when we meet with you to make sure you're well aware of what's going on. Then also that you're well aware of your the possibility or your options to be able to appeal that as well. All right, one real quickly, the Part D late enrollment penalty. If we do not enroll a drug plan when we first go on Medicare and we miss that open enrollment window, we could incur a late penalty, and that penalty follows us for the rest of our lives unless we qualify for Medicaid. I can't tell you how many people that I talk to across the country that this has happened to, because when they went on Medicare for the first time, they were not taking any drugs, or they were hardly taking any drugs that cost anything at all. And they just said, you know what, I don't want to pay an extra premium, so I'm just going to get the Medigap plan, but I'm not going to get the drug plan. That is not good for you, the Medicare beneficiary, because of the fact that you will incur a penalty that you cannot get rid of unless you qualify for Medicaid.